Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined by Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we're announcing 9 additional deaths due to COVID-19. This includes a female in her 50s from Interlake Eastern Health Region, a male in his 60s from Winnipeg Health Region, a male in his 70s from Southern Health Santé Sud, a female in her 80s from Southern Health Santé Sud, a female in her 80s from Winnipeg Health Region linked to the outbreak at Lyons Manor Senior Housing, a female in her 90s from Prairie Mountain Health Region, and that's linked to the Fairview Personal Care Home, a female in her 90s from Prairie Mountain Health Region linked to Fairview Personal Care Home, a male in his 90s from Winnipeg Health Region linked to the outbreak at Holy Family Personal Care Home, and a male in his 100s from the Winnipeg Health Region. And we extend our condolences to their loved ones and families, friends, and caregivers. And again, these are much more than numbers that we're reporting here. These are Manitobans who will be missed. Our current 5-day test positivity rate is 13.4% provincially, 14.6% in Winnipeg. 320 new cases of the virus have been identified. And, our message remains the same, is that these numbers are too high to sustain. They're putting too much strain on our healthcare system. We're losing too many Manitobans, so we need to stay home, reduce our number of contacts. And this is the best way to know we're reducing our contacts and hence cases. So stay home, leave only for essential reasons. Hand washing, physical distancing, wearing a mask in public. Ensure you're getting your flu shot if you haven't already. But we know we're at this critical juncture where we need to bring down these cases, and together we'll do just that. So thanks to all Manitobans. I'll pass it over to Lanette.
Thank you very much. Good afternoon. This morning we had 361 individuals in hospital with COVID-19. We're continuing to see people of all ages in our facilities, both the very young and the very old, and everyone in between. Our critical care program was at 161% of our normal pre-COVID activity as of this morning. And as of midnight last night, 116 patients were in critical care, 55 of whom were COVID-19 positive. 43 COVID patients were on ventilators. And last night, Health Sciences Centre opened up an additional 14-bed COVID ICU unit to bring the total number of ICU spaces across the province to 134. I cannot emphasize enough the impact that these COVID numbers are having on our staff throughout the system. They are tired, they are fatigued, they are stressed by the changes and the intensity that is upon them. We are about to show you the modeling that demonstrates the impact of the COVID numbers on our province, but also on our hospitals and our critical care capacity. And while the overall case numbers that we're seeing in the province are starting to stabilize somewhat, the admissions to hospital and critical care continue. And it's a scary thought to think about what would happen if we didn't have the restrictions and if Manitobans weren't doing their part. So we want to thank everyone for everything that you've done so far. What you do has an impact on so many people you care about, people who work in the health system. So with that, I think we will go right into the projection modeling. and I will hand it over to Dr. Roussin.
Okay, yeah, thanks. Just before we get into that modeling, I just wanted to make a quick correction. The very last death that I reported, a gentleman in his 100s from the Winnipeg Health Region, that's actually a gentleman in his 90s from the Winnipeg Health Region. So sorry about that error. So wanted to walk you through a few slides on some of the projected numbers that we've seen. And so we're going to give sort of an update on the COVID situation, but a glimpse into the various modeling scenarios that are guiding our response. And so we'll just move on to the next slide there. Okay, and so as of November 30th, Manitoba has conducted 357,707 lab tests. Of those, 17,107 positive tests have been identified. And since the pandemic began in March until November 30th, we've had 1,094 Manitobans hospitalized. We've had 204 total ICU stays, and we've had 333 Manitobans we've lost to COVID-19. And we certainly extend our condolences to all their families and loved ones. If we move on to the next slide here, like we've been saying, these are not just numbers, and it's easy to get lost in that as we report numbers. These are Manitobans that we're dealing with, has an impact on people, on our healthcare system, and we see that these new number of cases, they lead to more hospitalizations and unfortunately more deaths. So on average, for every 48 cases we announce, there are 3 hospitalizations and 1 death. So based on this, it means every time we announce 480 cases, we're going to see 30 people hospitalized as a result, and 10 people will die as a result of that. And so this is why we need to reduce those overall case numbers, protect our families, protect our healthcare system, protect all Manitobans. And our next slide. And so you can see that these case numbers have a direct relationship to hospitalizations and to death. So as case numbers increase, so does that impact the healthcare system and the risk to especially our most vulnerable citizens. And the case numbers that we're seeing is a part of really an unsustainable curve. The slide on the epi curve since the first COVID-19 case was identified in Manitoba is depicted there. This spring, we were able to control that first wave by a combination of preparedness, restrictions, these restrictions on travel and various activities. And of course, there was some luck there with our timing of the spring break, our geographic location. And so we saw that Manitobans really stepped up. We're isolating as appropriate. We're working from home. We're limiting excursions that were not essential, and as a result, we saw those case numbers very controlled in that first wave. So it was a significant sacrifice at the time, economic impact, a personal impact. But we did see that in that first wave, most of our cases were related to travel, which meant that we had limited contacts as people were to be self-isolating at that time. If you look at the curve here, you see that wave 2 is substantially greater than wave 1 in terms of these numbers. So our curve at present is far beyond what we're able to sustain in the healthcare system. We're seeing more cases in a single day than we experienced in the entire first wave. We're certainly not alone in experiencing this much harsher second wave. Jurisdictions across Canada, around the world, are experiencing much the same. But we're certainly not powerless. We've never been powerless against this virus. We know exactly what we can do to flatten this curve, to bring these numbers down. But right now we're seeing these test positivity rates above 13%. And these are very high rates and put our province at significant risk, at catastrophic pressure on our healthcare system. So our goal is not to eradicate this virus. We're in a pandemic, so we're going to see cases. But we do need to bring the number of cases down so that our healthcare system can respond. Our healthcare system can be there for all Manitobans who need it, not just for dealing with COVID. But we need all Manitobans to step up to bring these numbers down. If we move on to the next slide, we'll see just how the tragic impact. We've one slide back, maybe. Okay. I believe that's a bit out of order there. Oh, there we go. So that we can see the tragic impact that this has had on Manitobans. As we mentioned, as of November 30th, we've had 333 reported deaths, and our vulnerable populations are what are most at risk. This includes seniors as well as individuals with chronic health conditions. As you can see, it's predominantly our population over age 60 that are affected the most. But the COVID-19 is not a virus that only affects these people. We see all levels of our population affected. If we see on the next slide, we've seen that significant spike in deaths over the last month, unfortunately. It's taking younger adults from us far too soon. Since March, we reported the deaths of 1 child, 3 people in their 30s, 8 in their 40s, and 15 in their 50s. We can also see the number of deaths is increasing as case numbers increase. And it's certainly tragic, but predictable. As we see more cases, we're going to see more hospitalizations and unfortunately more deaths. And this is another reason why we need to keep these, or needed to put these restrictions in place to try to bring these numbers down. And next. And so based on this data to the end of November, we've seen more than 17,000 cases. As you can see, the cases have been identified in people of all ages, from children to young adults to seniors, and this virus affects these groups in different ways. And, next. Case numbers in children's an indicator that we've been watching very closely since the beginning. In the spring, we took drastic steps of closing schools, child care centers. We did that for an extended period of time as we needed to learn more about the transmission of the virus. Had significant impact on working families, also took a toll on both the educational needs and the mental wellness of many Manitobans. Since September, Manitoba kids returned to school and daycare. We've seen a steady increase in a number of COVID cases in young people, with children between age 0 and 19 accounting for approximately 18% of Manitoba's cases. With significant community spread, we can expect to see cases also increase in children. It's important to note that even with these case numbers, we are not seeing evidence of in-school transmission in the vast majority of cases. We have seen some schools with more than 5 cases identified, but an outbreak was not declared as there was not a strong evidence in in-school transmission. There were another 6 schools with evidence of in-school transmission. The majority of those cases have been linked to transmission outside of schools. And certainly here we need to acknowledge the efforts of our educational partners in reducing the transmission of the virus in these settings. We know there's evidence of less significant health impacts on this population if they do contract COVID-19. And to date, there have been 29 hospitalizations among people aged 0 to 19, which makes up about 2.7% of cases who have been hospitalized. Only 1 within this age category had been admitted to ICU. And then, as we announced earlier, tragically, we've had 1 Manitoba in this age group die. And so we'll continue to monitor this population quite closely. COVID cases in young adults aged 20 to 39 have increased steadily since early August, and that most rapid increase in mid-September. And really, this age group is where we saw the beginnings of this second wave. Although these young adults are less susceptible to severe outcomes, they carry and spread this virus. This is the group that makes up a large part of our workforce. They keep our services going and goods flowing, and the backbone of much of our economy. Because of these contributions, this group is often very active in our community. People are working, caring for children, shopping, providing support to older and more vulnerable populations. For these reasons, we rely heavily on this group to adhere to public health guidance. It's also important that they reduce their number of contacts they have. So just like all Manitobans need to stay home when they're ill, avoid large gatherings, teach your children, their older relatives about the importance of wearing a mask and other fundamentals. And next. These COVID cases in the population of people over age 60 have increased rapidly since early October. You know, again, the second wave started largely in the younger adults, but as expected, it would move to all age groups and is certainly affecting those in the 60 plus, and the percentage increase is seen even more in 70 and over. So these individuals are greatest risk of hospitalization. If hospitalized, they require longer duration for care. And so we can expect rapid increases in cases in this population is very likely to result in increasing numbers of death, hospitalizations, and ICU use. And next slide. And COVID-19 has been hitting long-term care facilities extremely hard, not just in Manitoba, but across the country. In the spring, we had these stringent lockdowns on visitor access to these facilities, and that helped prevent the virus being introduced into this population. Since fall, we've seen many outbreaks in personal care homes and very high rates of hospitalization and death. These outbreaks have devastating effects. Once that virus is introduced into these facilities, we see high levels of adverse outcomes. We've been reporting double-digit deaths on almost a daily basis for the last couple of weeks. We need to reduce the spread of COVID-19 in our communities, or we'll expect to continue to see these harsh impacts on vulnerable populations, both in community and in long-term care. So we're going to move on to some of the modeling data that we have. So since the beginning of the pandemic, we've been working on a model to simulate the spread of COVID-19. This model simulates the implications of the virus on the population and the possible burdens on the healthcare system. So it really simulates the life and decisions of all 1.4 million Manitobans, tries to capture all aspects of social life and relationships. This includes people's behavior in light of public health measures, such as a person's decision to practice physical distancing or self-isolating or staying home when ill. Once a person in the model is infected with the virus, we also simulate the disease progression. A person in a model may remain asymptomatic or have symptoms. They may choose to go for testing or not. What they do not decide is whether they'll need health care. The model simulates the biologic aspects of the disease progression, which determines if hospitalization or ICU admission is required. Therefore, our modeling can project the impact of positive cases on hospitals and ICUs. The model accounts for healthcare systems capacities such as contact tracing, lab testing, a number of clinical and ICU beds available in the system. Model is constantly being updated and revised as we gather more data and new evidence comes to light. Changes in public health behavior and public health measures can change the course of the epidemic model, which triggers revisions to the model. The projections we are presenting today include the period from August 22nd to December 31st, 2020. So we used baseline data from the first wave to calibrate the model. So this is from March 13 to August 22nd. This includes a total number of diagnosed cases, and that data is determined through diagnostic testing. We know that even if we were showing 0 diagnosed cases, there still may be cases circulating in the population that we're not aware of. This could be asymptomatic cases or cases with mild symptoms who have not been tested. And our model estimates that there could be 5 to 10 times more cases circulating than we diagnose. This is typical of most communicable diseases. We only diagnose a certain proportion of the actual amount of cases. And you can see that shown in the solid colored line there. The specific simulation includes all cases in Manitoba, diagnosed or not. The model also gives us a range of projections for a total number of cases. This is shown here in the shaded area. This allows public health to forecast case numbers and plan measures that can be implemented to reduce the spread of COVID-19. The range is based on the level of confidence and the variability in the projections. So we've mapped out 4 different scenarios. And it's really in light of the human behavior, in light of public health measures. So it accounts for the combination of measures, their timing, how much individuals' behavior can influence the spread of the disease. Individuals may perceive the seriousness of the situation in different ways. This dictates their level of compliance to recommended measures, thus increasing our ability to keep the outbreak under control. And so today we have these 4 scenarios that we're presenting. Scenario 1 in purple, marked extreme, is one where minimal public health restrictions are put in place and individuals don't follow the core public health recommendations, which include staying home when sick, hand washing, physical distancing. This results in the most amount of cases, a worst case scenario. Scenario 2 in teal, marked severe, is one where some public health restrictions are put in place and individuals still don't follow the core public health recommendations at an appropriate level. This results in higher case levels. Scenario 3 in gray is moderate, in which we have more public health restrictions are put in place and individuals start following the core public health recommendations. This results in a more manageable level of cases. And scenario 4 in blue, marked controlled, is one where strong public health restrictions are put in place and individuals follow the core public health recommendations, and this results in the least amount of cases, the best case scenario. So we want to make that very clear. The model is only one piece of this puzzle. It does not take into consideration economic factors or the effects of other diseases or conditions, only projecting COVID-19 numbers. It's a mathematical instrument that can help with some decision-making process, but can't be considered in isolation. In the end, we're dealing with a virus that's hard to contain, and we need to find a balance between public health measures and the social and economic well-being of Manitobans. In this slide, we're presenting Manitoba's daily number of diagnosed cases. This is that black line with circles on top of our 4 projected scenarios. The scenarios reflect the combined effect of public health measures and public behavior. Proper measures with good compliance should lead to fewer cases. Anything less than that will lead to more cases. By observing Manitoba's actual data, we can identify which trajectory Manitoba's epidemic is following according to the model. And that shows that right now we're at a critical place. We're following scenario 1, extreme. You can see here that we added in our strong restrictions on November 12. So I'd note that the test positivity rates still remain high, and for that reason it's too early to say we are changing trajectory. You can see the projected number of cases per day in scenario 1. In this current trajectory, with no measures taken, the model expects we would be diagnosing on average 825 cases a day by December 6th, and that has that range of 419 cases up to 1,055 cases. Additional measures put in place this month aim to change that trajectory. And so the actual data shows for the past few days we have been sitting at the lower end of that projected range.
The next few slides are going to walk you through what COVID-19, the impacts that it has had on the healthcare system. In particular, we're going to look at 4 different areas. The admissions, which is a count of the new patients who are admitted to the hospital on any given day. And we count an individual admission only once. The second area we're going to look at is occupancy. So depending on the situation with each patient, they may stay days, weeks, or months, but it is a cumulative effect. So we will be sharing how the hospitalized patients look in terms of occupancy and the impact that COVID-19 is having. We'll also look at the clinical bed impacts. Clinical beds, we refer to this as standard beds. COVID-19 typically will stay in a medicine bed, but as the capacity needs to expand, that may also include surgery beds, mental health beds, and other clinical areas. And lastly, we'll look at the ICU beds, which require more space and more technology around the critical care patient. So besides the basic oxygen and suction that every standard hospital bed may have, there's also medical gases in order to support ventilators, EKG machines, multiple IVs, and multiple professionals there to help with the patient care. This slide uses the modeling to show the projected number of new hospital admissions each day due to COVID-19 only. As we have seen in recent weeks with high case numbers, there are significant increases in hospitalizations as our cases rise. And this is especially true when the positive cases occur in vulnerable populations who are prone to more serious illness as a result of COVID-19. At present, Manitoba's daily number of hospitalizations are at the upper end of scenario 3, which is highlighted in red and presents a growing trend. With a larger number of cases, if we keep seeing this level of hospitalizations, or if COVID-19 reaches more vulnerable populations, we may have to start using the scenario 2 projection model to better prepare for the hospitalizations. And as you can see in these graphs, the number of hospital admissions fluctuates, but it does follow a trend. For this reason, it is still too early to be able to tell what the public health interventions, the impact on the number of hospitalizations may be, because as Dr. Roussin said, the number of cases that are diagnosed doesn't always indicate how much the infection is circulating in the community, and there may be a lag time before more cases are diagnosed or before they end up in hospital. Even in the current trajectory, case counts are still too high for our health system to be able to support the resulting pressure on hospitals and intensive care units for days and weeks on end. The restrictions in place now are trying to avoid a catastrophic impact on our health system's capacity. But this kind of event would not only affect COVID-19 patients, it would also affect any Manitoban who is in need of care apart from COVID-19. It's important to keep in mind that each day of new hospitalizations adds to those who remain in hospital from the days or weeks before. So that's the compounding impact on our health system and our healthcare workers. Building on what I just said, these graphs and projections show the number of COVID-19 cases in hospital on any given day. And we can see that compounding effect. Manitoba is currently following scenario 2, which is highlighted in red and represents the second worst case scenario. Our healthcare workers and our clinical leaders are working daily to increase our capacity to care for those who may need us. But these case counts over the past month have put us on a collision course to quickly reach the limits of what our healthcare system can support. Our goal is not to eradicate this virus. Our goal is to manage its presence at a level that allows our health system to provide care for those who need us. Not just those with COVID-19, but also those who have other health conditions that require hospitalization. In March, Manitoba had 1,843 medicine hospital beds across the province, as well as 632 surgical beds, for a baseline total of 2,457. By November, Manitoba had 2,386 medicine hospital beds across the province and 698 surgical beds, for a total of 3,084 beds. This is a 26% increase in the number of beds and means we are at 126% of our normal baseline. Our system is experienced at expanding capacity to meet increased volumes of patients, and we do it almost every year during influenza season. But in anticipation for the significant surge in COVID-19 activity and therefore the additional hospitalizations, our planning processes identified additional space, supplies, and equipment necessary to add beds as demands on the health system increased. This work began in the spring and has been refreshed this fall to include staffing models to support the anticipated surge. COVID-19 is not the only condition our health system must respond to. There's areas like trauma, stroke, cardiac care, renal, dialysis, cancer services, and many other priorities that must continue to operate, and they require appropriate skilled staff and other resources. Where we have slowed down services, reduced elective or non-urgent cases, we are talking in terms of weeks, not months, because these Manitobans, although they're elective and non-urgent, they are often living in pain and with limited mobility and do require these services. So while they're not elective, they are necessary. We have supplies, equipment, and space, and our planning is intentionally designed to ensure that we will not run out of any of these, even in a worst-case scenario. However, our vulnerability and the vulnerability of every jurisdiction is that of staff, who they themselves are at risk of fatigue, illness, or exposure as they fight this virus. With community spread being significant, the risk that healthcare workers will contract COVID-19 only increases. So we do need to get these cases down, and we need to protect those who will care for us when we need them. This graph shows the projection of the number of clinical beds required each day for COVID-19 patients only. The 100% maximum capacity line identifies all beds that can be assigned or reassigned to support COVID-19 response, and it includes existing clinical beds typically used for other types of care, and beds that we would add to expand our COVID-19 response capacity. This projection shows clinical bed utilization by COVID-19 patients only and does not include beds that are required for those who are in car accidents, have cancer, trauma, heart attacks, strokes, slips, falls, and influenza. If COVID-19 patients reach the maximum line as projected, there will not be space for any other patients. Hospitalizations due to COVID-19 fluctuate according to the number of cases, the age, and the health profiles of those who test positive for the virus. As we have seen through November, as this virus enters the more vulnerable populations, its impact can quickly escalate the number of hospitalizations required. While some patients may stay in the hospital for a few days, others may require weeks of care and only in intensive care unit. Manitoba is currently following scenario 2 in teal for clinical bed use. This scenario shows that with continued high case counts, COVID-19 cases could be expected to account for up to 50% of the clinical bed capacity in hospitals by December 17th or 18th. We have been adding capacity, increasing beds, and finalizing team-based models of care to support the staffing needs of medicine and critical care beds. But again, COVID-19 is not the only health condition that requires hospitalization. We are ramping up preparations for the low acuity overflow sites in the event that we are required to move less sick non-COVID patients out of hospital in order to accommodate more COVID patients and protect from COVID. With the help of Manitobans, we can avoid that scenario. The projections on this slide show the number of people in ICU on any given day related solely to COVID-19. Manitoba data is now in line with scenario 3 in gray for ICU occupancy. That's outlined in the red box. A shift in the age and health status of COVID-19 patients towards more vulnerable populations will increase the demand on ICU. And as we have seen in November, cases amongst populations who are vulnerable to the most serious effects of COVID-19 will increase. In March, Manitoba had 72 ICU beds. We refer to this as our baseline. Our ICUs are available to provide care to the sickest, most complex patients in Manitoba. Last November, our ICUs operated at approximately 75% capacity. We can expand our bed capacity to up to 173 beds to be able to provide care for the sickest Manitobans, including those with COVID-19 who must be admitted to an ICU. But our capacity is not infinite. And Manitobans who experience trauma or emergency surgery or strokes or heart attacks need to be able to access ICU care as well. Therefore, not all of these 173 beds can be used for COVID-19. COVID-19 has already affected access to health services for many Manitobans, and we must avoid a situation where COVID-19 demands reach the limit of our ICU capacity. As we watch the case counts climb each day, we have implemented various phases of our plan to expand critical care capacity in preparation for the surge that we anticipate coming, we knew was coming. And these beds are being opened as they are required. As of December 2nd, the province had 106 ICU beds in use. And at that time, 51 of the beds were occupied by COVID-19 patients. So this means that 48% of our ICU beds are filled by patients with COVID-19. Staff continue to be committed and dedicated to their patients, but they are tired. They won't let their guards down, however, and we are relying upon them to remain vigilant, to support their patients and their own families, to support Manitobans in general. This graph shows projected ICU occupancy for COVID-19 alone. The 100% maximum capacity identifies all beds that can be assigned or reassigned to support COVID-19 response. Again, ICU bed utilization is subject to fluctuations and is closely related to the health profile and age of the patients. Manitoba is currently following scenario 3 in gray for ICU bed utilization. COVID-19 cases alone may make up 50% of the available ICU capacity, and this scenario shows us hitting that mark by the end of the year. This scenario also shows that without the swift action to decrease case numbers and control the spread of the virus, COVID-19 cases could have reached the limits of our ICU beginning on November 23rd. It was because of the public health measures, expanded capacity, additional beds, shutdown of services, and redeployed staff that we have been able to avoid reaching our limit just over a week ago. We dodged a crisis that is reflected on this graph, but it also gives us a moment to pause and think, what are our next steps going to be, and how do we work together as a health system with the public to manage the case numbers going forward.
So based on these models and projections, Manitoba took action to bring down the number of COVID-19 cases. On November 12, we moved the province to critical or red on the pandemic response system. We introduced public health orders to restrict gathering sizes, shutter non-essential services, and reduce ways for people to gather. The health system's been working at the same time to add capacity, develop team-based models, and to find new ways to ensure Manitobans can access the care they need. New programs have been introduced to support healthcare workers and Manitoba families while the public health orders are in place. So what's this all mean is that we need both high compliance and strong public health restrictions in place. When these conditions are met, interventions are shown to be successful, and we can expect the current restrictions to follow that same pattern with widespread public buy-in. Our message to Manitobans today is this. Our current, very restrictive public health guidelines are necessary to rapidly manage widespread community transmission. We did not enter this situation lightly, and we, like all Manitobans, are watching closely to identify when we can begin to loosen some of these restrictions. The public has a significant role in determining how successful these measures will be. Right now, the restrictions are in place and are necessary with that widespread community spread that we are seeing. This means all Manitobans have to continue to work together to reduce the spread of COVID-19. With high levels of compliance, we'll be able to visit our loved ones in PCHs soon. We'll be able to keep our kids in school and their activities. We'll be able to gather with our loved ones once again. But right now, in the middle of it, we continue to have to stay at home. We have to reduce our close contacts and follow the fundamentals to keep our healthcare system functioning and to protect our most vulnerable Manitobans. And by following these public health measures in place, we hope to be able to achieve manageable levels soon and begin to once again ease these restrictions. So thanks, and happy to take some questions.
Thank you. A reminder to our reporters on the line this afternoon, you will have one preliminary and one follow-up question. Up first this afternoon from CTV Winnipeg, Turia.
Good afternoon. Dr. Roussin and Ms. Siragusa, you said that we dodged a crisis. We're not quite at the worst case scenario, but we're not far from it. Does the modeling suggest we should have locked down earlier?
Well, the modeling can't really tell us that. I think where we're at right now, it certainly shows that the trajectory has changed, or very early indications that trajectory has changed from the worst case scenario. But it's still at a level that we can't sustain. So we need these to come down further. So it's always at that balance on when you implement drastic restrictions that have a very significant impact on Manitobans, knowing that they can't be sustained forever. So the timing is challenging.
And now that we're heading into the holidays, I mean, it might be harder to, it might be harder for people to stay inside, I mean, even though they should. Would the province consider even stricter measures like curfews or limiting travel between cities within Manitoba?
Well, these the current restrictions are set to expire on the 11th, and we're working right now on what the next restrictions will look like. So when we have something to announce, we'll provide that information.
From City News, Jonas.
Good afternoon, folks. Ms. Siragusa, if I would like to just touch on some of these numbers with you and the capacity. Just want to talk about where we are right now with ICU numbers and just total numbers. I mean, given this modeling, and just kind of a Cole's notes on what we could see by the end of December, if you don't mind.
Well, based on the modeling, we are still on a trajectory that our numbers are going to increase. We're very grateful that they've slowed from what we anticipated a month ago, but it's still, we have to watch and wait in terms of who's coming in. As I said yesterday, we did open another 14 beds in critical care. And the thing with when people are admitted to critical care, it's usually not a short stay with COVID. It usually takes some time to recover and stabilize. So we're going to have to watch what there, as I also said earlier, there's a bit of a delay. So there's a delay from when we see the numbers and the restrictions were put in. It takes some time to have that ripple effect come into the hospital. But when we look at the projections, it's still on the incline. It's still planning. It's going to progress. So we'll just have to watch and wait and be prepared and get our staff prepared and hope and work with the Manitobans to follow the restrictions and keep safe.
Thank you for that. One number that isn't released in the modeling is death. I'm just wondering, I don't know, Dr. Roussin, Ms. Siragusa, if you could explain why that number was not released today.
Yeah, you know, and so again, the modeling numbers are just a view of multiple scenarios. They're not a crystal ball. They don't tell us what is going to occur. They tell us a few scenarios what might occur. So things like deaths, we've left out of the projections. But what we know is that with increased cases will come increased death, and we know our case fatality rate is around that 2%. And so depending on how many cases that we see, we're going to have that unfortunately predictable level of mortality.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Roussin, looking at these projections, we're straddling the worst and the second worst case scenarios for daily cases. So with this in mind, are you intending to introduce tougher public health measures in the next set of orders?
So those orders are expiring next Friday, the 11th, and so we're working right now on what the next set of orders will look like. So we haven't landed on anything specific at this point. So once we have that, we'll provide it to Manitobans.
Okay. So we heard, that there's 5 to 10 times the number of cases that are going undiagnosed in the community. We have really high rates of community transmission. Can you explain in plain language what will happen over the coming weeks if the public doesn't comply with these health orders, and if we don't tighten the public health measures, how do we keep from tracking on that worst case scenario over the holidays?
Yeah, and so you can see that worst case scenario, and we were tracking, at the higher end of that before we put on these greater restrictions on November 12th. Despite having some restrictions in place, we were still tracking at the higher end of that worst case scenario. Any real significant loss of adherence to our restrictions will take us back to that trajectory. And so that's why we need both public health restrictions in place. Again, we're going to have them in the least restrictive manner that we feel is necessary, but we definitely need a high adherence to those restrictions as well to just public health guidance, or we'll start tracking on that worst case scenario again.
From Global, Brittany.
Good afternoon, Dr. Roussin. The projections that have been released go from August to the end of December. I guess maybe just for people, explain why we don't release these projections a little bit earlier, because these will pretty much be outdated within the next 3 weeks.
Yeah, and that's the nature of models. Once you start modeling, really far out, months out, it really loses its value. So these type of models, what we'll see, we try to predict a few scenarios a few weeks out, giving us a bit better of an actual picture of that. So I think we're, along those lines, I think what we're going to try to do is have a bit more frequent sharing of this type of data, and that way we'll continue to keep Manitobans informed with it. But trying to graph out these projections much more than this, they start losing a lot of their validity.
And this is kind of for the both of you. Lanette, when we spoke with you a couple weeks ago, you said this would be the worst, we were in the worst case scenario. Today, saying we dodged a crisis, but we're not out of the woods. What do you say to Manitobans that are looking at these numbers, seeing that we're sitting on that low end of the extreme scenario, and on the high end of that could be up to 22 deaths a day, and people that are just getting tired of seeing these restrictions and feeling like they're not working?
Yeah, we're all getting tired of the restrictions for sure. It's a long haul. But I think we were on the worst case scenario track. If the restrictions weren't working, we would be seeing more like 800 or 1,000 cases a day. So it's working. And as bad as it feels, it could be worse. And I think we're moving in the right direction. The efforts of Manitobans is starting to show itself, and it's going in the right direction. So I think if we can push it a little bit more, get into a different, not so much the worst case scenario, but maybe more of a controlled situation, then we can lift some of those restrictions and start living our normal lives. But we're just on the precipice where we don't want to lose the benefits that we've gained, and we want to get us to a more stable place.
From the Brandon Sun, Colin.
Hi there. I was wondering if you might be able to provide more information on the outbreak that was declared at the Brandon Correctional Center, like how many inmates and staff members are infected, or how the virus entered the facility in the first place?
I don't have any details on that to share today. Maybe we can see what kind of information we can get out.
The other thing I wanted to ask is we had a reader reach out to say that they've been trying to buy some packages of like puzzles and little gifts for seniors in care homes right now. They're saying that current restrictions are making it very hard to find cheap options. I was wondering if things like puzzle books or little games might be taken off of the non-essential list, or if any changes might be coming to that list in the near future.
Yeah, and so so those the current orders are expiring in just a week. So we are looking at what further approaches we can, and I think with pretty much every aspect of those restrictions and including what's on the essential list. There's going to be things that make it and things that fall outside of it, and we'll review it. I think the big the message there was that we wanted people going out for essential reasons only. So we didn't want the people going out for non-essential reasons. There's still the option of online and curbside pickup. We knew it's relatively short, but we've heard of a number of examples on there that people felt were more essential. But just like every aspect, there's going to be some things that are in, some things that are out.
From CJOB, Malika.
Hi, thank you so much. This question is for Lanette Siragusa. I'm not really sure, but we'd be interested to get a reaction on the report out of the Nisitsu-Yawasik personal care home, saying staff are working 12-hour shifts for more than 50 consecutive days. Just looking to see if you have any information about that.
I'm not sure which report you're referring to. Can you just repeat that?
Yeah, sorry. In this report that one of our reporters is working on, it says that staff are working 12-hour shifts for more than 50 consecutive days. That was one of the findings in the report. Just wondering if you had any additional information as to like how staff are doing there, and if they're getting any help or tagged off or anything like that to help them.
Yeah, so we continue to identify where we can redeploy resources to support staff so that they're not working 50 days in a row. That sounds very extreme. I cannot confirm or deny because I don't know the details on that, but it's exhausting work right now. It is about reorganizing, rescheduling people. The other thing I would say is that in discussion yesterday with some of the people working at the regional health authorities, we've also heard not just how tired staff understand that, and we're working to help and bring in some reinforcements. We have hired lots of people. We're training more people. We're redeploying other people. We're bringing in external supports where that's possible, like the Red Cross. But what we're also hearing is that staff are feeling a lot of guilt and grief, and it's taking its emotional toll on our staff. So I just think we need to be thinking equally about how we support them physically. They absolutely need to have time off and rest in order to function, but they also need to have supports available to them. So we will be working through Incident Command. We will be working with the regions to make sure that whatever our staff need to get through this pandemic, that it's available to them. And I think each individual needs support in a different way. So we're going to have to look at different options for our team. But it's hard. I don't even know what to say, because we want to put more people around them, more supports around them, but this is a situation they face, and until we can get these numbers down, until we can limit that community spread, we're going to have to find a way to work with this.
Thank you. And this next question is for Dr. Roussin. You kind of touched on it a little bit about the comorbidity data, or the data of how many people have died from COVID in our province, but we're just kind of wondering to see if there's going to be some additional data coming out with underlying health conditions at all being detailed, as to see if there was underlying health conditions, how many there were. Is that data being collected, and will that be provided?
So we do collect it, and this is something that we might share as a composite. We wouldn't be sharing it for at the individual level, but overall, I think we could share some of the risk factors that we're seeing. I think that by far the biggest risk factor for COVID-19 is age. But we see a lot of underlying conditions repeatedly, so we could look to see how we can present that.
From the Winnipeg Sun, Scott.
Good afternoon to you both. Dr. Brent Roussin, you talked about it in the technical briefing, but I'll ask you here as well. People are going to look at slide 10, the one that shows school-age children, those under 19 that have had cases, and the sharp rise in those cases. If you look at the dates, roughly around September 8th in school, the school started again, and those numbers rose. Can you explain to people why they shouldn't make the, I guess the comparison or the I can't remember. I don't have the word right now, but the comparison between the cases rising in school-age children and schools being open, and why that's not just because those numbers show that, why those numbers, as you guys said, don't actually reflect in-school transmission.
Yeah, and so this is, what we often refer to, the difference between association and causation. And so we see those numbers climbing at the same time as the second wave starting. So they're coinciding with community-based transmission of the second wave. They just are occurring at the same time. They're not indicative of transmission within schools. One, we can look at the data within schools, and despite the number of children in schools, we're still seeing relatively low rates of illness. Despite the number of cases within schools, we're seeing very low levels of transmission within the schools. And then if you look at just the overall age breakdown, the number of cases in each of the age cohorts, you can see that the younger ages are not what's driving this pandemic.
Thanks for that. And my follow-up question is, do you guys have any idea, based on even the modeling or any of that, what levels of compliance we're actually at right now among Manitobans? If we're not seeing any real reductions in cases, I mean, we're seeing some a little bit, and obviously we haven't hit that high end yet, or that that extreme high end of like roughly 800 cases a day. But the province at times has tried to paint it as just a few bad apples not complying. But I'm just wondering if that's the reality, and why are we still seeing these high numbers at this point then?
So there's a number of possible explanations for it, and you saw that even despite having still significant public health restrictions at the beginning of November, we were tracking in a worst case scenario, and that was modeling at that we as if we had no restrictions and really no adherence to public health recommendations. And so there is, at least early trends showing that things have, decreased escalating. And there still is the chance that we'll see some of these numbers dropping as a result of these restrictions. But when we put in these stringent restrictions, we certainly were looking to have the numbers lower than what we are now. And so we know that these restrictions are the appropriate type. We look at the evidence, and we've vastly restricted how Manitobans can gather. So that implies that there's some adherence issues. Some of that relates to population subtypes, as we mentioned, people in that are homeless and related issues. It's much more difficult for them to adhere to these, not having the choices that other Manitobans have. So there's a number of issues like that, but nonetheless, we need to be in a better spot than where we are moving forward.
From CBC Radio Canada, Amelie.
Good afternoon. How could we reach the best scenario if we already have strong restrictions at the moment in the worst, from the worst scenario? Do you have any modeling of this?
Well, I think we need some form of strong public health restrictions, which we do have in place, and then we need quite a bit of adherence to this, and so that comes with with all those messages, staying home when ill, self-isolating completely when required to, and then adhering to all those restrictions. So, so if we really see that, we can see these numbers come down. We have early indications that that's what is occurring. It's not as fast as what Manitobans wanted to see, but we can see from that modeling data that there's been a clear shift, but we do need more.
Thank you. And my follow-up question is, COVID-19 patients from Nunavut have been transported to Winnipeg. How many patients from Nunavut is Manitoba equipped to receive, given the current pressures on our healthcare system?
I'm not sure how many have come down to Winnipeg from Nunavut, but we always consider Nunavut part of the the people we serve. They don't really have another option up north. So we will accommodate them as we need to within our Manitoba population. And if we get into trouble, then we would escalate higher up for support, like we would do in any situation. If the Manitoba numbers become higher than we can manage, we would seek help beyond Manitoba. But for right now, as they come in, we will continue to serve them, treat them, and I believe many of them are also in isolation.
From CBC Manitoba, Bart.
Hey, Dr. Roussin. Looking over at slide number 20, and you can see that in early October, we're getting a trend that's even well outside your extreme scenario. So I got to ask, why weren't tougher restrictions, really tough restrictions, escalated beyond the orange, like right then and there when you saw things blowing away your worst case scenario at that time?
Yeah, and so this is the benefit of hindsight on these type of things. So we from the beginning with this pending second wave, we said we would do as much as we can to have that targeted approach, to have the least restrictive means to make a difference. We saw that work out quite well in the Prairie Mountain Health region when we targeted them. And so we absolutely did see numbers increasing, and we tried the targeted approach. We tried those various orange restrictions to try to bring down those numbers, but you could see that we didn't get the buy-in from it, and then were eventually required to go to red. So we couldn't predict at that time that we wouldn't get buy-in with the orange restrictions. We have to put them in and then see the results. Because the restrictions that we have in place right now are not sustainable for the long term. So we can't just rely on stringent restrictions like this for great periods of time. And so at the time we tried that targeted approach. It didn't work, and we had to continue to escalate our restrictions.
Thank you for that. Now, why do you think you didn't get that orange buy-in in October? I know you mentioned homeless population and the few bad apples, and we heard all those cases before, but obviously it was broader than that. Why didn't Winnipeggers in particular buy into the orange restrictions in October?
Well, I don't think it's limited to Winnipeggers. I think you look around the world right now, look in many jurisdictions in Canada have very tight restrictions on again, and numbers are climbing. And so I think it has a lot to do with the time of year, that this is the second wave. This is when we normally see escalating respiratory virus season. And then fatigue. We've been at this for 9 months. And I think that Manitobans, just like probably everyone else in the world, want to be done with this virus and want to be done with these restrictions. But unfortunately, we're not. And our modeling shows what will happen if we loosen up on this. So, so we have these tight restrictions on place. We're getting trends at least in a better direction, but we're not there yet.
From the Canadian Press, Kelly.
Kelly Malone, the Canadian Press. Ms. Siragusa, you say that hospitalizations lag 10 to 12 days after new cases. So we were still seeing significant case counts near 500 a day, like 10 to 12 days ago. So are you starting to see those people enter the hospital yet? And is there capacity currently for those expected numbers?
So we report the admissions every day, or every day that I'm here, the admissions to hospital and also the critical cares, and we have been seeing them increase. Again, who requires hospitalization or critical care depends on the infected person, their age, and their comorbidities, their general health status. So it's a projection. It's not an exact science. Early on, we were seeing exactly, almost statistically exact, what we expected would be admitted into hospital and into ICU. We've been a little bit stable the last week, I would say, but we are continually seeing admissions. So as mentioned earlier, we have opened the 14 beds at ICU in Health Science Center because the numbers are continuing to increase. It's a compound increase, so as they stay days and weeks, it means we have to keep adding, layering on. So in answer to your question, we are seeing them come in. It's not an exact ratio in terms of the acute cases to the admissions. It does depend on who's being infected, but the numbers continue to rise.
Obviously, news this week is the expectation of an approved vaccine within days. So how could a vaccine, even if it's only distributed amongst vulnerable populations, which you, Roussin, say are being impacted during the second wave at a disproportionate rate, how would the vaccine kind of impact any modeling or projections? How important is that, I guess, for our situation right now?
Yeah, so I mean, I think that the receipt of a vaccine approval and the ability to start vaccinating Manitobans will be, certainly important. It's going to be scarce at first because of the worldwide pressures on this. Early on in 2021, we're not going to have enough vaccine to start achieving herd immunity, to start having vaccine that will start necessarily bringing down overall case numbers. But what we are planning on doing is if we can vaccinate those most at risk of severe outcomes, those that are most at risk of spreading to people at most at risk, what we do is we start affecting our hospitalization and case fatality rate, some of the severe outcomes. So if we target the right groups, all else being equal, we'll start seeing some improvement in those numbers.
From the Steinbach Carillon, Josh.
Hi there. Could someone provide an update on the Bethesda Hospital capacity situation?
I don't have an update. Do you have an update? Sorry, we don't have an update for you. Do you have specific questions that we could get back to you on?
If this is still my first question, I'm just wondering if the capacity is sort of increased or stabilized or reduced.
We can find that out and report back.
Okay, thank you. I'm also wondering about the test positivity rate in Steinbach as well as average daily tests.
Yeah, so the test positivity rate is trending downwards, still in the 30s in that area. I would say that today's the absolute numbers in the Steinbach area was 11. So we're seeing a trend in the right direction as well of the of overall numbers. I don't have the testing numbers in front of me.
From Chris D. Digital News Service, Tammy.
Hi, good afternoon, Dr. Roussin and Ms. Siragusa. My questions are for Dr. Roussin. Unfortunately, you're announcing people dying day after day, and it's very taxing on the families, especially when the funerals are capped at 5 people. I was curious to know, when people can't get proper closure, what kind of mental health supports are in place at this time to help somebody to cope?
Yeah, and I think that this is just another example of how tough this the pandemic has been, right? And to lose a loved one is the toughest thing to do, period. And now having to navigate all of these restrictions at the same time just adds to people who are already suffering. And so it's just such a challenging time for people. So there are mental health resources available. Can go to manitoba.ca/COVID-19. There are sessions that are available there. We encourage people to follow up with their healthcare workers, their healthcare provider when necessary. There's some virtual options as well. So again, that message that we're seeing transmission of this virus, but it's very safe still to see your healthcare provider, to reach out to your healthcare provider, and I'd encourage everyone who needs to do so to do so.
Okay, thank you for that. And would you also consider, with the limit of five people going in to say goodbye, sitting by their loved one's casket, those people leaving, the funeral home director doing a clean, and then another 5 going in, just for the therapeutic reasons, the closure reasons, and if not, what would be the reason for that?
Yeah, well, so actually the current orders are groups of 5. And that doesn't include the official at these. And so in a scenario where you had a group of 5 that attend and completely leave, and a complete separate group of 5 come entirely separately, that's still a group of 5. So those type of things could be done. Again, we're trying to limit gathering, and we all understand why we're doing that. And so, that has to be done in the strictest of terms. There can't be large groups of people even gathering in the parking lot or anywhere else in the facility. It would have to be entirely separate groups of 5. That would not be outside of the orders.
Thank you.
From the Neepawa Banner and Press, Ken.
Good day. Can you hear me?
Proceed.
Hello?
Go ahead, Ken. Go ahead, Ken.
Hello, can you hear me?
Yes.
Yes, we can hear you, Ken. Please proceed.
Hello, can you hear me now?
Yes.
Yeah. Maybe Ken's not hearing
Hello,
us.
can you hear me? Okay, sorry. Thank you. Sorry about that. I want to thank both of you for doing a tremendous job in the whole healthcare system. I can personally attest to that. I just had cancer prevention kidney surgery a week ago today in Winnipeg. Anyway, I understand there's 132 approximately care homes in Manitoba. Can you tell me how many have been fortunate enough or well managed enough to not have any COVID outbreaks whatsoever?
I don't have the exact tally in my head, but there are some for sure. But it doesn't mean that any PCH, we have them all on high alert right now with the situation, the community spread. So there are, I can give you a breakdown, but I don't have it in front of me.
I think that's a testament to the hard work of everybody involved. The second thing, from the chart today, if I read it correctly, you're looking at 48 cases results in 3 hospitalizations, results in 1 death for 48 cases. So of the every 3 people that are hospitalized, are we to assume then that 2 recover and are able to go home?
Yeah, well, this is kind of on average for it, so it certainly depends on on that individual circumstance. So these are overall averages, and so you can see there that's unfortunately our case fatality rate is around 2%. Which is fairly standard in other areas, and then we see that the 5 to 6% hospitalization rate. So it's hard to generalize about that, but those are just the overall averages.
Thanks, everyone. This concludes our media briefing.